Welcome back to HealthWise. I'm Reggie Tatum, and with me today is Dr. Mitchell Lirtzman. And we were talking before the break about where he was from and how did he end up in Louisiana. But now we're going to talk about the dreaded triple A's, which is basically stands for abdominal aortic aneurysm, which Dr. Lirtzman specializes in as far as surgeries and taking care of. Doc, can you tell us a little bit about what exactly, for the audience, what it is so they'll know?
An aneurysm essentially is a weak spot on an artery. You can have an aneurysm anywhere in the body from the top of your head to below your knee. And it is basically a weak spot like a blister on a tire. And the most common site for aortic aneurysms, and of course you know the aorta originates in the chest at the heart, it ascends up into the upper part of the chest and then turns over and goes back down through the chest into the abdomen. Once it traverses the diaphragm and goes into the abdomen, it gives off a branch to the stomach, liver, and spleen. It gives off a branch to the intestine. It gives off 2 branches to the kidneys, and then there's a space, and then branches off to the legs. That space between the kidneys and where it branches off to the legs is called the infrarenal aorta, below the kidneys. And that is the most common site of aortic aneurysm, and this is what we're talking about today. There are a number of causes for aneurysmal disease, ranging from the genetic. There are certain genetic mutations and genetic formations such as Marfan syndrome that predispose a patient to aneurysm formation. There are metabolic problems where a certain enzyme may not be expressed properly in the system that allows the elastic components within the wall of the aorta to weaken. And there are the degenerative components, which is your run-of-the-mill arteriosclerosis, which
basically hardening of the arteries.
That's exactly correct. And the small feeder arteries that give nutrients to the wall of the aorta are slowly will deteriorate, and the elastic components of the aorta, which the aorta is not a solid structure like a rubber tube. It is layered. And part of those layers, aside from the glistening inside and the firm outside, part of the layers on the middle part are biological elastic. Not the elastic that's in your shorts, but biological elastic, which allows the vessel to rebound with every beat of the heart. And as these elastic fibers deteriorate, the aorta will enlarge. And this doesn't happen in everybody, and there's no reason, there's no way to know in whom it's going to happen. But we do know who is at risk.
Okay. Well, all right. Basically, if someone gets an aneurysm, and I know the answer to this because we work on the ambulance a lot, and we've had a couple of cases, but yes, if this happens and they get an aneurysm in the aortic abdominal area, what's their chances, or do they have chances of survival?
Well, aortic aneurysms are, for the most part, silent and present no symptoms as they grow. Most patients will never know they're there until they become symptomatic. When they become symptomatic, in other words, when they burst, there is about a 50 to 70% mortality rate, means they don't make it to the hospital or through the surgery. It can be deadly. And it also depends on where this aneurysm bursts, what part of the abdomen. If it bursts freely into the abdominal cavity, that's that. Yeah. There's massive internal bleeding, and unfortunately, the patient will expire. Sure. If it ruptures into the tissues surrounding the aorta, sometimes that rupture can be contained.
Right, there's some pressure on it.
That's right. And while there is some bleeding into the tissues, it doesn't freely bleed into the abdomen. And so the patient, while that person may be in shock, they're still alive. And the keynote to that is that when these things become symptomatic, when they burst, patients experience the worst pain they have ever experienced in their life. It is I am told, worse than childbirth, worse than a kidney stone.
Wow.
It is horrible pain in the abdomen, in the flank, and in the back. And once that's diagnosed, then they can be taken directly to the operating room for life-saving surgery.
Sure. Why is it that what causes the pain? Why would
It's the tearing of the tissues. It's the separating of the tissues one from the other, and there are pain fibers deep in there. And as the blood courses into those tissues are stretched and pulled apart, and it's exceptionally painful.
Okay. All right. Well, Doc, we're going to take another brief break for our sponsors, and after that, I know you have some examples,
Yep.
and we'll see what exactly you do to repair aneurysm, aortic aneurysm.
Happy to. Thank you.
Okay.